Today I want to share a little bit about my sort of personal journey in this path of hormone replacement and peptides. Um, I think it's important to know that I believe in this stuff enough that I do it myself. So it first started actually with hormone replacement. I felt a lot of the symptoms people talk about: lower libido, kind of decreased energy, decreased ability to recover from workouts. So all those things led me to thinking about hormone replacement. And of course, being a 50-year-old guy, my testosterone was on the lower end, which is normal for my age, but clearly that contributes to changes in physiology and all the things I mentioned. So after doing some homework on the safety of it, and I'd actually been providing this for patients, but then I needed to get my own treatment. So I kind of went the path of going through some online providers. And what struck me with that process, and I actually tried two of the bigger name online providers, is that it was really just almost these sort of chat bots that were answering questions I had. I really had no interface with a human being. In fact, in one of these, I was recommended cholesterol medicine, even though my cholesterol wasn't checked. It has been, it's actually not elevated. So there's a clear flaw in how a lot of um, these types of services are provided currently. So I realized I want to be able to provide a much better experience for patients, one that was more comprehensive, more real. I mean, it just includes interfacing with real people. But again, most importantly, more comprehensive, where we're looking at overall health. It's not just you want testosterone, here it is. You want a GLP-1, here it is. This is let's look at your overall health. If you want one of those things, sure, let's make sure we're not missing something else. So that's how HitX kind of evolved. Is this idea that there's demand for this, but it has to be done um, kind of responsibly and in a way that, again, is personal, individualized, and looks at a person's whole health. Because ultimately, health is the ultimate goal here, in addition to the sort of concept of physiologic rejuvenation. So, anyway, I started with testosterone, certainly felt the benefits of that. Um, but I was still having some issues that a 50-plus-year-old guy who likes to work out and be active is going to feel. So, specifically, um, my right knee would get an effusion, which means it would swell after certain activities. Um, and that was really uncomfortable and would force me to kind of take a break from working out, which was a bummer because, the longer you take a break, the harder it is to get back into it. So there was this sort of, and I talked to a friend who's an orthopedic surgeon, and of course it was like, well, you probably have some arthritic meniscal changes and damage. And I knew what that meant. That traditionally would lead to rest, potentially an MRI and getting scoped, and a process that can lead, in my opinion, to kind of ongoing damage. So again, that's where I pursued some alternatives, discovered this world of peptides, specifically BPC 157, which is a well-known healing peptide that can be used in different ways. It can be used orally for gut health, but in this case, I needed it for kind of a localized injury. In that setting, it's actually used as an injection intramuscular, not in the knee, but around there. And lo and behold, after a couple of weeks, knee felt better. I was able to be active. The last 2 years, I haven't had that issue flare up at all. Had other things happen. Once again, I've used BPC. So it's helped me heal from the types of injuries that at my age I'm more prone to when trying to be really active. And then on top of that, the next thing I did was use a peptide that increases growth hormone. So just like our testosterone decreases as we age, so does growth hormone. A lot of things decrease. The process of aging is really losing a lot of our physiologic functions. So we're trying to counteract that. And again, if we can do it in a safe way, it makes sense. So one peptide I used, and this is for like a 3 to 4 month period. This is not ongoing, but it's again a peptide that stimulates growth hormone. So it's not an exogenous or artificial synthetic growth hormone. it's a molecule that's telling my pituitary to make my own growth hormone. So it really is kind of a natural process. And what I found during those 3 to 4 months is when I was working out, I felt stronger, I recovered faster. So in those 3 to 4 months, my sort of physical fitness level was able to jump up a level, and then it allows me to maintain it. So this is something that you might do in intervals, but it kind of just gives you a boost for those few months. And it's something that, again, at a certain age, you just can't do on your own. We just need the help at that point. So for me, it's been a remarkable journey. I feel really stronger and fitter than I have probably in about 20 years, which is incredible to say at my age. So I'm really thankful for these. If you're interested in any of this, please reach out to us.